Hello, I'm Janice. I'm going to be your nurse for today, and I'm here to do an assessment on your head, ears, eyes, nose, throat, and mouth. Okay? And how old are you? Hmm?
Yes,
Okay. And what's your name?
Navi.
All right, Nadia. So I'm going to do the assessment. I'm going to have to ask you some questions, and then I'll touch you. It's not going to be painful. It's not going to hurt you. So it'll just be me applying pressure. Okay? All right. So I'm going to get some hand sanitizer to sanitize my hand and make sure that I have clean hands while I'm touching you. And I'm going to start off with your head. So your head and your hair. Your head is nice and normal cephalic. It's not abnormal. So it's the right size. It's round for your head. It's the right size for your legs and your body frame. So it's not abnormally large or it's not too small. Microcephaly. You have a lot of hair. Noted that it's black. It is thick. No sores, lesions, lumps, or bumps. And is there any pain while I'm touching your head?
No.
All right. Now I'm also going to look at your face. Your skin color is even. It's not abnormal. I don't notice any lesions, scars, or any dry skin. So that's good. Um, Now I'm going to look at your facial, which is cranial nerve 7. And I'm going to ask you to do a couple of things. And before I press all on your face, I'm going to apply my gloves. Um, so I'm going to look at your face. It's nice and symmetrical. Your eyes, your nose, your lips, your nasal fold, and all of that. Everything is normal. Um, So I'm going to ask you to close your eyes and close it tight. And I'm going to try to pull it, but you just keep your eyes closed. All right, so that's good. I'm going to also ask you to smile, frown, and then puff out your cheeks for me. And then I'm just going to press it and air escapes evenly, so that's good. Was there any pain or anything that was hurting you while I did that?
No.
And while you okay. So now I'm gonna palpate your temporal and ask you to clench your teeth for me. Okay, I feel that muscle there, which is the temporal, and I'm also palpating the temporal artery. Okay, now I'm gonna touch the uh, temporal mandibular joint, trigeminal mandibular joint. And I'm going to ask you to open and close your mouth for me. Okay, and is there any pain when you did that? No? Okay, so that's normal, it's non-tender. I'm now going to look at your nose. Your nose is even. It's the appropriate size for your face and your age. It's not abnormal. I don't notice any nasal polyps. I don't notice any bleeding or drainage or running mucus. Now I'm going to ask you to place one finger over a nostril and inhale and exhale. Breathe in and breathe out. All right. And then do the other nostril. Breathe in and out. There, I noticed it's a clear patency, so it's nothing that is congested there. Now I'm going to look at your mouth. And I'm going to be working and looking at your cranial nerve number 9. So I'm going to ask you to open up your mouth while I look at it inside. I'm going to ask you to say, ah. Very good. The uvula is rising, going up and down. I don't see any inflammation. Your teeth are all intact. Thank you. And her mucous membranes are nice and moist and pink. Gums are pink. Now I'm going to ask you to stick your tongue out, which is cranial nerve number 12. And I'm going to ask you to move your tongue from left to right. And then I want you to say light.
Light,
tight,
light, tight,
and dynamite.
dynamite.
Okay, very
Light,
good.
tight, and dynamite.
That's right. So cranial nerve 12 and 9 are intact. Everything is normal there. I'm going to be looking at, I also need to inspect and palpate your facial and maxillary sinuses. So I'm going to apply pressure here. Just let me know if it's painful. I'm going to apply pressure under your eyebrow. Is that okay?
Mm-hmm.
Non-tender, and then I'm going to apply pressure there. All right, and it's non-tender, no pain. I didn't notice you jerking or moving, so that's normal. It's non-tender. Now I'm going to palpate your lymph nodes, and I'm going to name each one of the lymph nodes as I palpate. And this is your preauricular, and I'm using circular gentle motions. I'm not applying very hard pressure there so that I can feel the nodes. And this is the postauricular, and then the occipital. Are you noticing any pain, tenderness, or any soreness while I palpate?
No.
Thank you. Okay. I'm going to palpate the submental, and then the submandibular, the jugulo-digastric, the superficial cervical, then the deep chain cervical. And just let me know if you feel any tenderness. The posterior cervical. Can you turn your head one? There you go. Post-cervical and post-cervical, no pain there. And then lift your shoulders up for me, and I'm going to palpate the clavicular. Subclavicular. All right, there you go. And did everything feel okay and normal there?
Yes, it feels okay.
All right, now I'm going to look at your ears. And I'm going to look at your ears to make sure and pull down and back for the little kid. And your ears are nice, clear, and clean. I don't see any scabs, lesions, sores, or lumps and bumps. And then I'm going to look here. Ears are nice, clean, no lumps, bumps, and no torn abrasions or anything there. I'm going to do the cranial nerve number 8, which is the acoustic hearing. And I'm going to let you, let's see, let me palpate here. And there's no soreness or tenderness either there, right? Okay.
No.
So I'm going to let you press this side of your ear, and I'm going to whisper a word to test your hearing.
Strawberry. Great.
Okay. So everything is intact there. Your hearing seems to be normal and okay. Another thing that I want to do is I want to test your vision, which is the 6 cardinal gaze. And I'm just going to have a light. I'm going to look at your eye, and I'm going to ask you to follow several commands. Your eyes, though, are clear, moist. I don't notice any drainage, dry skin. I don't notice any discharge in your eye. I'm just going to put my hand here and look at your conjunctiva. Conjunctiva is nice, pink, and moist. I'm going to shine this light and look at your eyes. And I'm going to try to notice pupil restriction. There we go. There we go. Okay. All right, very good. And I'm going to ask you to follow my light, okay? This is testing the cranial nerve 2, 3, 4, and 6. So this here, the 6 corner gaze is going to test the cranial nerve 3, 4, and 6. So I'm going to ask you to follow the light, or you just follow my pen. That's one. Okay, very good. Very good. Very good. Very good. Very good. Okay, and then I'm going to bring it to you. Okay, very good. And then look at my pen over here. And then I'm just going to look at your eyes. Okay, and that's just testing the vision that's far away. Now look ahead of you at the wall, and I'm just going to observe your eyes from the side. And the sclera is white. Pupils are round. And the pupils are black. The iris is dark brown. And I'm going to go in this non-concave. Going to go around to the other side and look at this eye. Sclera is white. The cornea is non-concave. Pupils are round and black, and the iris is dark brown. Very good. Lastly, okay, so there your pupils are equal, round, and reactive to light and accommodation. I also would like to grab something and test your cranial nerve 2. And I'm going to ask you to read the words that are in big print there.
Kool-Aid.
Okay, that's right. So cranial nerve 2 is intact. Very good. And lastly, I'm going to check your neck, okay? So I'm going to make sure your trachea is intact in midline and it's not inflamed or misplaced. And so it's even, it's in place, and there's the right indentions in space on both sides. I'm going to come behind you, and I'm going to touch your neck, and I'm going to ask you to lean your head to the left for me. And I'm just going to, can you swallow? There, okay. And can you swallow here? Okay. Thank you. So, did that hurt anytime?
No.
Okay, so I felt, and it wasn't inflamed. I didn't feel anything. I did feel that you did swallow. And it wasn't painful for you to swallow. I don't feel any lump bumps or anything. So it seems to me everything came back normal for your age. Like I said, your mucous membranes were fine. You did swallow. And I think I need to do your mouth. Did I do your mouth already? And ask you to say, ah. I did? Okay. So I did everything. And I did your nose. Oh, that's right. I might have to record this over.
No.
But,
Yeah.
okay, and I also need to do your smell test. So, let me get you cranial nerve number 1, which is to smell.
That's my candle.
Mm-hmm.
I know what that smells like.
What?
Donuts.
Vanilla.
Donuts.
Donuts? All right. There we go. So cranial nerve number 1 is intact. Okay, so this is my report to the next nurse about my assessment on Navia, age 10, female. My report is that I did an assessment: head, eyes, ear, nose, throat, and mouth. Head was normocephalic, so it was normal for the age and body size. No lesions, abrasions, sores, or lumps or anything were noted. Facial extremities and everything was normal, midline, everything was symmetrical. Eyes, ear structure, nose, mouth, all of those were intact. I didn't notice any abrasions or skin lesions, sores, or exudate anything of the face. The eyes and the eyebrow and the arch and everything were normal. The structure was normal. The facial and maxillary sinuses were non-tender upon palpation. Temporal artery was palpated. Mandibular and temporal strength was present. No pain or soreness or tenderness there. The eyes were, the pupils were equal, round, and reactive to light and accommodation. The sclera was white. The iris was brown and the pupils were black. Non-concave. The cornea was non-concave. There were no drainages or discharges. The conjunctiva was pink and moist. The nasal was midline. It was not asymmetrical, so it was normal, symmetrical. No drainage or nasal polyps were noted. No deformities. The mouth was moist and pink. The gums were pink. The teeth were intact. The uvula did rise upon saying I. The tongue, she was able to extend the tongue and move it from left to right. No sores were observed. She was able to pronounce the light type dynamite, and the ears were symmetrical to the face. No debris or no skin breakdown, no tears. Was able to hear and repeat what I said. So did pass the cranial nerve 8. The 10 lymph nodes were palpated, and they were non-tender. They were not inflamed. They weren't sore. And was able to close the eyes while I pulled and placed my thumb to stretch, and so the strength there was strong. Air did escape when I was testing the cranial nerve 7. Air did escape when I palpated on the cheeks lightly, equally. The trachea was midline, no soreness or abnormalities. It wasn't misplaced. The thyroid gland was palpated. I was able to feel the thyroid gland move up and down, and it was not enlarged or anything. That is my report to the nurse on my oncoming shift.